You hit your goal. Clothes fit. Energy is up. People are noticing. And then you stop taking Wegovy. A few weeks go by. Appetite returns. Weight creeps up. And suddenly you are asking, was it even worth it? Let us break down exactly what happens after you stop Wegovy, why weight regain is common, how your body reacts, and what you can do to maintain your progress without the medication. Here's the hard truth first. In clinical studies, when people stop Wegovy after a year or more of use, about 2/3 regain a significant amount of the weight within a year. Why? It is not just willpower. It is biology. Wegovy works by mimicking a gut hormone called GLP-1. It slows digestion, reduces appetite, and helps your brain feel full with less food. When you stop taking it, those hormone levels drop. Your stomach empties faster. Hunger signals come back louder. Cravings return. And unless you have a solid plan in place, your brain starts pulling you back toward old patterns. But here is the thing. Weight regain is not guaranteed. You can absolutely maintain your results, but it takes strategy, not just hope. Step 1, taper. Do not stop cold turkey. If you're thinking of stopping, talk to your provider about gradually lowering your dose instead of quitting overnight. Even a lower maintenance dose like 1 milligram weekly might help smooth the transition. Step 2, reinforce structure before the stop. That means tightening up your meal habits, sleep, hydration, and movement while you are still on the medication. So when the appetite control fades, you are not rebuilding from zero. Step 3, build muscle. Muscle helps you burn more calories at rest. And people who focus on resistance training during and after Wegovy are far more likely to maintain their new weight. Even 2 sessions per week makes a difference. Step 4, stay emotionally prepared. One of the biggest surprises for people after stopping Wegovy is the return of food noise. That constant chatter in your head, snacks, cravings, guilt. If you expect it, you can meet it with strategy instead of panic. Things like meal planning, pre-commitment, therapy, or mindful eating all become tools, not just ideas. One patient I know had lost 35 pounds on Wegovy. She stopped at month 9. At first, everything felt fine. But by month 2, she was grazing again, skipping workouts, and the scales started creeping. She went back to a half dose for maintenance, and that was enough to hold her at her new set point. For her, stopping completely was not the answer. Adjusting was. If you are hoping to come off Wegovy and keep the weight off for good, here's your quick checklist. Taper. Do not cold stop. Lock in healthy routines before you stop. Focus on strength, not just cardio. Track your hunger and mood during the first 6 weeks. Have a follow-up plan with your provider. And remember, going back on Wegovy is not a failure. It is a tool. And if your body needs a tool again, that is not weakness. That is wisdom. If this helped you feel more in control of your long-term plan, like the video, it helps others avoid the same trap of blind stopping. Coming up next, something surprising: Wegovy and sleep apnea. Is it more than just a weight drug? Subscribe so you do not miss that one. And if you have stopped Wegovy before, how did it go? Regain? Maintenance? Drop your story in the comments. You could save someone else a lot of struggle.